Thanks for staying with us here on the Midday News. April of each year is Oral Cancer Awareness Month to raise public's awareness of oral cancer. The annual campaign is to stress the importance of early detection of oral cancer, which experts say would go a long way in decreasing morbidity and increasing long-term survival. It's often grouped together with oropharyngeal cancer, which is cancer that develops in the back of the oral cavity and upper throat. Together, these two cancers are the sixth most common type of malignancy worldwide. Traditionally, exposure to tobacco and alcohol has been the most common risk factor. Today, however, infection with the human papillomavirus is increasingly responsible for oral cancer. Just like other cancers, when detected early, treatment-related health problems are reduced and survival rates may increase. The death rate associated with oral and oropharyngeal cancers remains exceptionally high because they are routinely discovered late in development. For more on this, I have a dental surgeon, Dr. Ololade Beckley, who is joining me via Zoom. Thank you so much for joining us on the news this time. Talk to us about the significance of checking out one's oral cavity to ensure that one is free of cancerous cells. Dr. Beckley, can you hear me?
Okay, now I can hear you. Good afternoon.
Yes, good afternoon. I'm not sure you heard the first question. I was asking the importance of oral cancer awareness, the significance of marking this day.
Okay, thank you very much. So the significance basically is because of where we are in this part of the world. People are not proactive. They would rather wait until it has degenerated. So we need people to know that, okay, this type of cancer is common here, and there's treatment, and that early diagnosis or early detection will help in treatment. So it reduces the number of fatal cases we have.
We are not sure how prevalent this oral cancer is in Nigeria. What are the signs and symptoms to look out for to ensure that one doesn't have this, these signs?
Okay, so the symptoms basically to look out for are when one has lumps or swellings in the mouth, when there is bleeding, unexplainable bleeding, sores that have refused to go, weight loss, when the way one's teeth would usually just align together. If there's a change, one needs to also let the dentist know. Also, for denture wearers, if the dentures don't fit as well as they used to before, then one should notify the dentist immediately.
So how often should an individual screen for it? What are the, where can we find a free or low-cost screening in Nigeria?
Okay, if I heard you correctly, you asked about where people can access dental care to be able to screen for oral cancers. So basically, everyone is supposed to go to the dentist twice a year, every 6 months. And there are private clinics, government hospitals, PHCs around where people can access dental care.
Dr. Ololade Beckley, dental surgeon, thank you so much for your insight. Thank you.